Monkeypox is spreading across the country and fast. The White House declared the outbreak a public health emergency. The announcement comes amid criticism of the Biden administration's handling of the outbreak, with more than 7,000 cases confirmed nationwide.
It's a big story they've been following. ABC's Reena Roy has the latest.
As monkeypox cases rise coast to coast, the Biden administration declaring a public health emergency in an effort to control the spread.
The public health emergency adds extra tools to our toolbox, allows us to speed up vaccines further, allows us to unlock new funding. So there are a lot of good reasons to do the public health emergency now.
Infections topping 7,000 nationwide, including a few pediatric cases. Demand for the vaccine outweighing supply.
People within the community are very frustrated. And they're frustrated because they're having to call, they get messages, they have to wait for people to call them back. But I need everybody to understand that we are trying.
The CDC says nearly 1.7 million people in the U.S. are now eligible for the monkeypox vaccine. So far, about 600,000 doses have gone out nationwide, with 1.1 million total expected in the coming weeks. But it isn't enough, with 2 doses needed for full protection. Critics say the White House response has been disappointing so far.
Asking the Department of Public Health, asking my PCB, how do I prevent more lesions? And I was told nothing. I just don't think they were prepared.
Nearly all the cases have been among men who have sex with men and their sexual networks. But doctors stress anyone can get the virus. 5 children in the U.S. have been infected. The virus is primarily spread through skin-to-skin contact. Monkeypox is rarely fatal and symptoms usually go away on their own.
The presentation of monkeypox is variable from person to person. I've seen some patients recover from their illness within 2 weeks, but others, unfortunately, they don't recover until maybe 3, 4, or even 5 weeks later.
The FDA says it's looking into whether it can stretch the vaccine supply by pulling 5 doses out of a single vaccine vial without sacrificing safety or efficacy. Reena Roy, ABC News, New York.
Well, according to the latest data from the Virginia Department of Health, there are at least 139 possible monkeypox cases in Virginia. That includes 17 in the eastern region, which is our area. The numbers are a little lower in North Carolina. 86 possible cases have been reported there.